Okay, so hi everyone. Today we're going to be talking about the impact of abuse of over-the-counter medication in Lebanon. So let me start by introducing the topic first. So over-the-counter medication, we're going to talk about the drug misuse. So OTC drug misuse refers to the improper or excessive forms non-medical purposes, and even sharing medication between each other, which is non-prescribed. So risks, including liver damage due to excessive medication intake, masking serious conditions due to the misuse that can delay proper medical treatment for any underlying disease, and finally, overdose or poisoning could also happen. So moreover, this issue affects mostly the health and well-being of individuals in Lebanon. So this is why we found it was linked to SDG 3, which is good health and well-being. Moreover, it's also related to SDG 12, which is responsible consumption and reduction, since controlling the amount and frequency of using these drugs will for sure reduce the waste and the wrong consumption of those drugs. So those are one of the main reasons why my group and I found that, and I found it best as pre-med and pharmacy students. So let's start with the research question that was going to be asked, which is what are the most effective strategies for promoting the safe use of over-the-counter drugs in Lebanon, mostly targeting the deficiency in public awareness initiatives. And we found this, highlighting this deficiency is important since we are going to be later on doing actually ourselves a public awareness initiative and further surveys, which Gabriela and Isabella are going to be talking about in more detail later on. So,
okay. So next point we're going to talk about are the objectives. So for this study, we aim to tackle three main objectives. The first one being to evaluate the duty of pharmacists and doctors. So we all know that around the world, pharmacists are responsible for the safe selling of drugs to the population. However, in Lebanon, we don't really see this standardization in which pharmacists have a say in what their patients, what type of medications they purchase, and how much of the dosages they take, and overall their consumption patterns. Moreover, in Lebanon, we don't really see doctors advising in terms of the types of medications, specifically OTCs, since they don't require prescription. So this study, we want to analyze, like pharmacists, we all know that for sure they have a role in medication, but what are the roles of doctors specifically, and how can doctors be used to tackle OTC misuse? The second objective we aim to complete is assess the underlying aspects leading to public lack of awareness about OTC safety. So in Lebanon, we know, as I said, OTCs, they do not require prescriptions. But we want to assess the underlying cause, because we can never fix a problem without knowing the cause. So we want to know, is it the lack of public awareness initiatives? Is it the culture or like the notion of self-medication and treatment? Or is it due to financial backgrounds? Or do they think that pharmacists and doctors don't have a role in tackling OTC medication abuse? This is what we want to try to assess on a larger scale. And we want to examine the digital medical strategies. So the whole point of this digital medical strategy is to target a wide range of populations, because as we know, like nowadays, the target population, if we want to change the stigma regarding something, would be to target the younger kids. And how can we reach a large audience using social media and online platforms and websites? And these websites, they would promote healthy OTC consumption and usage, display the negative health effects, have like doctors and pharmacists like a Q&A section. So this is the whole point of what we want to examine would be the best alternative in order to tackle OTC misuse in Lebanon.
Okay, and now the next thing that we want to tackle is our literature review. So again, our topic was based on the impact of abuse of over-the-counter medication in Lebanon. So what we did, we grouped a bunch of studies together, we did a bunch of research, and we targeted them into 4 different categories as we see here. So the first thing that I want to talk about is the OTC medication collection and pharmacist duties. So based on the several literatures that we researched about, we found 2 ones that are correlating, which is Dimasi et al. And Abbas and 2016. So starting with Abbas, what we found is that mostly people who are buying medications are prioritizing brand prestige. So if you see Panadol, you want Panadol, but if you see something similar, you're not going to buy because you don't know what that brand is, which is scary to some people. And also, there's a lack of effective pharmacist involvement. So the patient comes in, they want this, they don't want to listen to what the pharmacist has to say. Now, moving on to Dimasi, also a little bit more elaboration on it. Uh, they Patients often say that they can self-prescribe and self-diagnose themselves without having to listen to a pharmacist, and that we're not seeing any role or any influence, which is making pharmacists feel like they don't have a role in they don't have a say in the matter or what they're doing. Now, to move on to health hazards and harmful effects, again, we found two literatures that are correlating together. So let's start with Mahadi. So Kamena, we saw that increased OTC misuse is actually causing drug resistance, especially when it comes to antibiotics such as Augmenta, for example. This is an OTC medication that everyone takes for no reason. Example, they literally gave my mom Augmenta for some random inflammation 2 weeks ago. And we also have insufficient awareness campaigns to prevent people from the misuse of OTC medication. And when we look at Ramya et al., it's another evaluation or another extension. And when people have side effects, when they start seeing the side effects or the resistance and toxicity, they're not going to go seek guidance. They're probably going to think like, okay, this is normal, it's going to go away. That's not true. And also another thing that we saw that is related to each and every 4 points is that there's a lack of financial incentives involved. Some people that don't have enough money to go see a doctor or something, they're just gonna self-diagnose themselves and think that's it and they're okay. So third of all, we're going to look at the management, policy, and the widespread availability of OTC. Now, since OTC is not requiring a prescription to purchase it, there's a lack of regulations and the lack of implementation because of the lack of regulations. There are no safety precautions. There's no safety precautions, and everyone just buys them randomly and freely. And often they like to jumble up their prescriptions. They'll just start taking pills after pills after pills. And this is something that has a really this is something really detrimental to our society. And also, as we see in Jamal on our right-hand side, it is also OTC drugs are very overconsumed, which again, we can link it to all four all four topics that we have picked. And also, there's no digital framework that is going to help motivate people and monitor the process. And finally, when we're going to look at self-treatment and self-diagnosis, there are a lot, like I said before when I talked about Dimasi, there's the paracetamol in Lebanon, Panadol, everyone just overtakes them. This correlates to the self-medicating culture that we do have in Lebanon, again, lacking awareness, and we don't have any promotion or guidance when we want to teach people about OTC medication.
Okay, next. So after reviewing around like 30 pieces of literature, we came up with common gaps that the literature has failed to address or they address without giving an effective implementation. First of all is the deficiency in public awareness initiatives. Many research papers stated that we lack public initiatives in Lebanon. However, none of them effectively proposed how are we going to design or lay out such an awareness campaign. Moreover, healthcare workers' responsibility in tackling OTC abuse. As I said, pharmacists are well recognized for this role. However, we're missing a crucial aspect, which is the doctor's role in this tackling the OTC medication abuse. Digital and initiative derived, which is what I said was the goal or one of the objectives for this research paper, was to find a digital version of a public framework in order to reach a larger target audience. The economic, societal, and cognitive aspects. So we mentioned briefly that maybe due to like the lack of financial incentives, this is why people are not visiting the doctors yet. However, none of the papers that we read like clearly explored that topic in depth and tackled the root cause of it. And lastly, OTC medication employment in marginalized communities. Most of the studies we read, they tackled the broad population, like people living in areas such as Beirut and Tabarja, but not like the rural areas like Albak or Akkar or regions like that. So they're leaving them out, and this is partially discriminated.
Okay, so now when you want to talk about what we use as methodology and framework, we decided to combine two frameworks, which is going to be HBM and CAP. And because we decided to combine them, we decided to give it a new name, which we called the GEI framework, which is Gabriela, Ilona, and Isabella. So I think based on Dr. Watfa's videos and from before, we understand what HBM and CAP are. And now we're going to combine them in order to address the knowledge gaps, the external factors, and the willingness of individuals to change their habits and make sure that we have safe OTC medication patterns. Okay, so when we look at our HBM variables, we have 6 variables. So we want to see perceived susceptibility. We're going to be familiarizing ourselves with the OTC hazards, and we need to self-interpret how at risk we are. Severity includes the fact that we don't understand how severe something is until it actually happens to us, and then we wake up. And the perceived benefits, what's the benefit of us actually changing our ways and to make sure that we're taking OTC medication safely and in a regulated manner? When we look at the barriers, we're going to look at what is stopping us from being safe with OTC medications. Is it lack of awareness? Is it lack of knowledge? Is it stubbornness? Is it lack of financial incentives? And the cues to action. How are we going to change our ways? It could be via digital tools. It could be via awareness campaigns. Are we going to actually start listening to our healthcare professionals, our pharmacists, and our doctors, and the government body and the monitoring system? The comprehension of regarding OTC guidelines, and we need to have faith, and we need to be well established, and we do need to understand what is going on in our system.
So the next section, we're going to talk about the CAP variables, which is knowledge, attitude, and practice. And these are the two frameworks that we combined into the framework that we call the GIE. So first of all, knowledge. We all know that when we're familiar with the health risks, this is when we're going to be like, we're willing to take actions because we're actually like scared, or we believe in the true health hazards of OTC ill use and malconsumption. Attitude, it's how much confidence or the faith we have of like altering our health consumption patterns, and will they really affect us or not. So it's the faith that we have in the knowledge that we receive regarding the health hazards. And finally, the practice is the regularity of OTC medication consumption. So as you notice, our knowledge affects our attitude, and our attitude towards change will determine whether the practices that we adopt are actually effective or not, and whether they're sustainable. This is the combined framework that we came up with. So we decided to design 6 hypotheses. We're not sure which one we're going to work on yet, but these are possible hypotheses we designed. So for instance, hypothesis number 1, we decided to combine perceived severity with knowledge, because when you have the appropriate knowledge, you will be able to perceive how severe a situation is. And this led to the formation of hypothesis number 1, in which increased awareness levels will guide the Lebanese population to enhance their knowledge on the risks of OTC medication. And another example, for example, hypothesis number 4. We combined the perceived barriers with the attitudes, and we formulated the hypothesis about how the negative connotations or our attitude perceives us and we're able to seek advice about OTC drug use. It will increment the barriers and decrease the utilization of OTC drug safety. So as we know, we've realized that these two frameworks are very compatible with each other. So in order to avoid duplication and to enhance our overall framework, we decided to combine both of them, as you can see in the figure in front of you.
Okay, and so for our data collection method, what we've decided to do is, first of all, I want to run a survey. This survey will be distributed...
One more minute, one more minute. Yes, thank you.
Yeah, all right. So we decided to cultivate a survey which is going to be spread onto local pharmacies, universities, and schools in order to gain different opinions and perspectives in order for us to fully raise awareness on OTC misuse in Lebanon. And also to enhance this awareness, we're going to be doing a website later on to collect even more information and provide information to our fellow colleagues and public of Lebanon to be able to raise awareness on the misuse of OTC medication. Now, we did develop a couple of survey questions that we're not going to share with you right now because we're short on time, but this is the general goal. And concerning the website, this is going to be spread publicly either via Instagram or TikTok or regular websites of our respective pharmacies.
So finally, to talk about the timeline and project milestones that we're going to work on. By week 5, we did the research topic. Week 6 and 8, we finished the literature review, the research question, which where we are right now. Week 9 and 10, the data collection will start. By week 12, the data analysis and all of the statistical results needed for the surveys and so on will be done. And by week 13, the final research paper will hopefully be done and submitted. So the key takeaways very quickly will be the lack of public awareness, which is the major driver of the OTC misuse. how the pharmacists and health professionals are underutilized, and the targeted public awareness that can improve the situation, the initiatives, which are what we mostly are going to be working on. And finally, the resources are all present on the actual sample research project that we submitted. Thank you.
Thank you.
Okay, perfect. Thank you so much. Just on time. If you don't mind, can you still share the presentation while I'm talking?
Sorry, that was the timer.
Okay,
Okay.
perfect. I don't know if those others watching, I mean, this is the I think the perfect example of what I was looking for in many ways. Okay. I mean, if you don't mind, go back to the literature review map. I mean, again, everybody I saw today was amazing. Again, don't get me wrong, but this is a very beautiful literature review map. It really tells the story. Four bubbles, some papers here with references. These are the things they kind of found out. These found out. You know, it tells a story, and the story is clear. And in the middle is what they're trying to do. This kind of gap they found out, and then after that, immediately go to the next slide. Um, they summarized the gap for us. They said, "Oh, we read all these. We created a map. Maybe my small feedback, if you don't mind me saying, you said you read around 30 papers, right?
Right. Yeah.
Around 30 plus or minus, but your map only showed maybe five or six. I mean, that was my only maybe minor feedback. A bit disappointed there. I don't know why. If you go to your map, you focus on maybe six, seven papers. I think, yeah, if I counted them, you will see many of them are repeating themselves. And you said 30. Where are the others? So maybe that's kind of not telling the whole story. Maybe that's my minor feedback there, maybe constructive for next time. Maybe build on that if you don't mind. But this is beautiful. I could say, I could keep on going. And I'm saying it because others will watch this video later on, students to come. This is a very good example for them to follow. I meant maybe bigger. Make sure everything is included. Yes, before you, we had other projects also. They did an amazing job, but it wasn't maybe my comment was, I wish we combined them and show it better. So I love this. The other thing I loved, and I super loved, is the framework. I mean, this is the first project today so far. I'm sure I'm going to have others. Yes, this is exactly what I'm looking for. Yes, you have all these beautiful frameworks here and there. You come and take them and make it your own, you know? Yes, you could make it even better as we go on. But for now, for the proposal stage, definitely this is a very clear framework with clear hypotheses, with clear variables where you got them from. So again, super happy with this. Yes, it could be a bit better by adding more connections. Of course, as we go on, you're gonna expand on this, but this is a beautiful foundation to build on top. So I'm kind of, yeah, to be honest, I don't have too many questions. I mean, I think you nailed it from every single direction. I love the topic. I love the plan. I love your attitude. You're on the right track. All you have to do now is to deliver what you promised, and I'm sure you will. I'm sure you will. So I think I'm excited about this project. Thank you so much. Thank you for your time. Thank you. Bye bye. Bye bye.
Doctor, I sent you a message yesterday,
One
so at
second.
like
Let me stop
7.
recording. Let me stop recording. 1 second.